you must see a lot of younger people too.
We do, and children and adolescents and people that are certainly younger than I am, and hospice is certainly not limited to people with very advanced age or advanced
Right.
age at all. It's quite common for people to be in their 40s and 50s and
Sure.
need hospice care. And in the hospitals, when I worked in the big teaching hospitals in Boston, we'd see a lot of very, very difficult circumstances where our patients were in their 20s and
That's
still were hoping and really desirous of a full and rich
Right.
life to come, no matter what kind of illness they had.
Sure.
And it was a privilege to help them and sustain those
Right.
hopes. And I don't know how, and I don't know why, but some of them would somehow fight their way through this thing. And I didn't look for an explanation,
Wow.
but I know that they came through, and some of them did well. And a lot of people do very well on hospice,
Right.
and are able to say, you know what, I don't need hospice anymore. I'm going down to Foxwoods.
Oh, that's amazing.
And if circumstances change and they want to come back, well, we'll bring them back. But we're very happy when someone graduates
sure.
hospice.
That is wonderful. Yeah, because, that's why I'm glad you're here, because I never heard that anybody graduated from it, you know?
Well, I don't want to bore you with statistics, but
Right.
let's in our country this year, about 1.4 million people will be enrolled in hospice care, and more than 200,000 of those will wind up graduating from hospice.
Wow.
And we don't know who it's going to be.
Right.
I'd like to think all of them are going to.
Sure.
But lots will, because
That's wonderful.
they receive supportive care in every way that we can provide it, and they fight their way on through the illness, and they receive family support, and they get stronger, and they do better, and they may come back. They have to be very sick in
Sure.
order to come on to hospice, but a lot of people benefit from what we provide and graduate.
Well, there are miracles.
I believe in them.
I do too.